When I got to grad school, I was surprised that speech language pathologists also do swallowing assessments. I'm about to show you a tool I developed based off of continuing education I completed, and it operates as my quick checklist of what I should be looking for during bedside swallowing assessments. Let's have a quick look. The continuing education course I took was the Modified Barium Swallow Impairment Profile, or the MBS-IMP, and this is a systematic way of evaluating video fluoroscopic imagery of a swallowing assessment. This means that my clients are assessed by mixing barium with various food consistencies, and then a video x-ray is taken while they chew and swallow. The barium shows up on the x-ray and can help us identify where any of the following issues may arise. So here's what we're looking for in the modified barium swallow impairment profile. First, we're looking to see if there's any impairments in the oral component of the swallow. Component 1 is lip closure. Are any foods or liquids leaking out the front of your mouth? Component 2 is tongue control during a bolus hold. Is the tongue coordinated enough to keep the bolus or the food that you're chewing or liquid contained so that there's no spillage into your cheeks, out the front, or prematurely down the back of your throat? Component 3 is how efficient is the chewing or mashing process? Is it disorganized? Are they leaving it mostly unchewed and just swallowing mostly whole food? Component 4 looks at how efficient is the tongue at transporting the food and liquid to the back of the mouth. Component 5 wants me to check and see if there's any residue in the oral cavity, where some people might have to do a lingual sweep, which is where you get your tongue and you sweep it around your mouth to check for any residue. Component 6 is the initiation of the pharyngeal swallow. So now we're getting to the throat aspect. We've got 3 constrictor muscles up here, the top, middle, and lower, and they squeeze in sequential way to help get the bolus down. We want to make sure that the initiation of the pharyngeal swallow matches the timing with which the bolus is ready to start going down. If the food or liquid starts going down before we initiate that pharyngeal swallow, it means it could get down into our lungs and cause pneumonia. Now we're into the pharyngeal aspect of the swallow. So we just finished oral, and now we're looking at the throat component. You know where that dangly thing is at the back of your mouth? Your uvula? That is actually part of a muscle that is supposed to contract and rise to close off your nose when you swallow. If that seal is not strong enough, food or liquid could get stuck in that flap and or eventually come out your nose. Component 8 is laryngeal elevation. Your larynx is where your voice box is, or your Adam's apple. That's your thyroid cartilage, and your vocal folds are right behind it. When we swallow, if you put your finger on your Adam's apple, you want to feel it actually go up and then come back down after the swallow is complete. That's laryngeal elevation. We want to make sure that that hyolaryngeal excursion is big and strong enough to make sure that everything is closing and sealing off the way it needs to keep your swallow as safe as possible. So component 8 is how high does it go, and component 9 is your hyoid bone, which is the U-shaped bone at the crook of your neck where your chin and your neck meet. There's a U-shaped bone there called your hyoid, and that is supposed to move forward a little bit based off of the muscles that are involved when you swallow. Component 10 is epiglottic movement. Your epiglottis is a piece of cartilage. So if this is the base of your tongue, the epiglottis is right here, and it sits on top of your trachea or your windpipe. And when we swallow, the epiglottis is supposed to move down to cover your windpipe. And food and liquid are supposed to go around and down your esophagus or your food tube. So component 10 is looking to see, is that epiglottis deflecting or making full movement to come down and cover your wind tube, your trachea. Component 11 is how well is your larynx, your vocal folds, closing at the height of the swallow. If those muscles are not squeezing tight enough, there could be a gap where food or liquid could come down into your lungs. And again, that can cause aspiration pneumonia. Component 12 is the pharyngeal stripping wave. I mentioned a series of muscles in your throat, and we want to see that it is sequentially squeezing the food and liquid down. Component 13 requires an anterior-posterior view. So usually in a modified barium swallow, you are looking at the side profile, but For component 13, they want you to be facing the X-ray machine so that we can see if there's any asymmetry. For example, if there's weakness, then more food or liquid might be prone to going down the weak side and getting stuck there. Component 14 is how well is your upper esophageal sphincter, the circle of muscle that keeps your food tube closed at the top. How well is that opening to let food come down when you need it to? Is there any obstruction there or too much tension? If so, that could lead to a buildup of residue. Component 15 is tongue base retraction. So the base of your tongue, we want it to be fully compressed against the back of your throat, and we don't want to see any contrast material between your tongue and your pharyngeal wall. Component 16 is pharyngeal residue. Is there any food or liquid remaining in the throat? That poses a risk because if there is buildup of residue, it has the potential to go into your lungs, which again could cause aspiration pneumonia. Finally, the last thing, component 17, we're looking at esophageal clearance. Is the food and liquid moving efficiently through the esophagus, or is it getting stuck? I don't know about you, but I was surprised to learn that there are 17 components to a swallow. I hope you found that as interesting as I did. If you have any questions about your swallowing function, you can self-refer to your local speech language pathologist. Assessment and some treatment is usually covered by extended health benefits through work. Thank you and have a fabulous day.